part of one of the deadliest epidemics of the new millennium, but knowing very little about it. That's what Steve Johnson this debilitating disease and finding hope in small doses. Steve Johnson is like a drowning man hoping someone will throw him a lifeline. Steve is 43 and has a wife and 4 kids. He has a big house in the suburbs with a pool in the backyard. And Steve has a disease that few people are aware of. A disease that, according to the Centers for Disease Control, in 10 years could kill more people than AIDS.
My feet were so bad that I couldn't stand. The back was so bad and so forth I couldn't sit. I couldn't lay for long periods of time because of my shoulders and neck and so forth. So it was in the energy level.
Probably, again, exposure to blood or blood products or bodily fluids.
Steve is just one of the 4 to 5 million Americans who have hepatitis C, a viral infection that kills by destroying the liver. Dr. Douglas R. Lebrecht is Director of Liver Services at University of Iowa Healthcare in Iowa City, and one of the leading experts in the country concerning hepatitis C.
At the moment, we have about 8,000 to 10,000 people dying each year from hepatitis C. It's estimated that that number will increase by 2 to 3-fold by the year 2008 or 2010. It accounts for 50% of all liver transplants in this country. We're doing between 4,000 and 5,000 liver transplants at this point, so it's easy to see that we will not be able to save all those lives that are currently dying from hepatitis C, much less the increased number that are coming over the next decade simply by liver transplantation.
Hepatitis C is spread primarily by contact with the blood of an infected person. Anyone who received a blood transfusion prior to 1992 is at risk of having hepatitis C, as is anyone that is or has been an IV drug user. But you can also get it from sharing things like a razor or toothbrush with someone who has hepatitis C. It has been called the silent epidemic or silent killer.
The vast majority of patients with hepatitis C never have an acute or clinical illness. That is, they don't develop the usual symptoms of hepatitis: jaundice, weakness, fatigue, nausea, vomiting, which heralds an acute infection with viral hepatitis. The vast majority do not have those symptoms, and the disease takes an average of 15 to 20 years to develop clinical consequences. And if we wait until they have symptoms, until they already have cirrhosis, the treatments that we have are not going to be very beneficial.
Steve Johnson believes it was a blood transfusion in the early 80s that infected him with hepatitis C. Always thin, Steve knew something was wrong when he started gaining weight.
I'd blown up like a balloon, put on about 100 pounds, most of it being water weight. And so I went into the doctor and my general practitioner, and he said that I had to have my gallbladder removed and I had some swelling to my liver. And so at the time they did remove the gallbladder, they did a liver biopsy, and at that time they found cirrhosis. It was only known as hepatitis C for 5 or 7 months prior to the time I was diagnosed.
According to Steve's wife, Ronnie, hepatitis C was so new at that time that their general practitioner couldn't answer their questions of what is it and how do we get rid of it.
I said, well, okay, we'll learn it together. So then I started getting on the internet and going to the library and reading books, and I have this one herbal book that I started reading on, and I'd take it to work and I'd just read at work, and everybody's like, are you studying to be a doctor? And I was like, no, but studying to get my husband well.
Ronnie and Steve found that there wasn't much information concerning hepatitis C, and from a number of doctors that there wasn't much hope. The little information they did find, they tried to share with others by forming the Hepatic Liver Coalition. The purpose is to increase awareness, education, and to promote organ donation. Steve and Ronnie also organized a 4th of July parade with the proceeds from food sales going to the Hepatic Liver Coalition.
We need to get the word out. We need to educate people. And we need to let them know that you could get it from a toothbrush, a water pick, fingernail clippers, blood transfusions, hemodialysis. So the education is a big thing.
Worldwide, as with most viral diseases, the U.S. is relatively lucky.
It is estimated that 170 million people worldwide are infected with hepatitis C. While only around 1% of the population in the United States has contracted the virus, there are places in Egypt, Central Africa, and northern China where the carrier rate is as high as 10%. At this time, there is no vaccine, there is no cure, and treatments are effective only 40 to 60% of the time. Steve's only hope is for a liver transplant. That lifeline has recently been thrown to him by the lead transplant center in Omaha, Nebraska.
I need a prescription that doesn't come from the drugstore, some type of hope. And I've got a lot of hope right now myself.
We're always interested